Hello, in this talk, which is a collaboration between Virgin University Amsterdam, Badana University, and Kutikpur Hospital, we're going to look at a research methodology to study the impact of work-related injuries, especially in Bangladesh. The transdisciplinary research is getting popular recently. It is a very inclusive and participatory process in which complex problems are studied so as to create solutions that are real world and that are tangible to be implemented. So it engages non-academic stakeholders, that is to ensure that everybody who are involved with or affected by a complex problem are engaged to produce solution. It is a process in which knowledge is created by learning from each other, from each of the various stakeholders, and through a process of collaboration and participation, decision making is taken so that there is ownership of that decision among all stakeholders so that solutions that are generated can be implemented for real world changes. So there are various types of disciplines. We are familiar with the monodisciplinary research that we do as clinicians. Sometimes we do multidisciplinary with the role of surgeons, combining with therapists and others within the same discipline. Whereas in interdisciplinary research, we involve others who may not be part of our primary discipline. But transdisciplinary also is a research where we engage with those who are in the non-academic environment to ensure a rather comprehensive and participatory nature to engage all the parties involved in relation to that complex problem. So, looking at hand injuries in Bangladesh, currently there are not much available published data on the impact of hand injuries. As we know that hand injuries can be devastating and we're all familiar with that, and they do produce not only a biophysical impact, but the psychosocial and economic impact of hand injuries in Bangladesh has not been studied. The incidence is fairly high, we are all familiar with, yet there are no proper published data on this, as we are aware that most of hand injuries are preventable, but it's also known that men who are the main breadwinners can be exposed more to these injuries due to the nature of their work. And in Bangladesh, we are familiar that the injuries are not just work related, some are at home and in agricultural environment. One of the important factors has been the lack of safety and health measures within the workplace. And also, a big problem is the implementation of legislation for the protection of workers. So, in this paper, we are proposing a research project to use this transdisciplinary framework to understand the impact of hand injuries in Bangladesh and how to produce solutions through a process of collaboration and participation of the stakeholders. So, the objectives of this research would be to first explore the effects of work related hand injuries in Bangladesh. Until we know what is the impact of these injuries on the patients, their families, and communities, we will not be able to generate solutions. So once we have understood that effects on the hand injury patients, we then need to identify and engage stakeholders through a process of understanding how the injured patient is treated and rehabilitated. This will be through interviews, focus group discussions, and from there we can then generate the concerns and issues and challenges faced by the patients and those who are engaged with the patients either in their treatment or in their occupation and community, and then generate solutions. From these solutions, then an action plan has to be developed to implement them in the community, first through a pilot project and then to scale nationally. This is the proposal. So the research question for this research would be, first, what are the experiences of the workers in Bangladesh who have suffered from work-related hand injuries. So this would be a qualitative research involving a lived experience, also known as phenomenology, that can be used to study. And this needs to be done first. Following this, we will do a transdisciplinary research process where we identify and engage the various players and stakeholders, and through in-depth interviews and focus group discussion, understand the concerns and expectations and challenges faced. From them, we will then generate solutions for the problems and then implement it in a pilot study in a small community to see its effectiveness. This transdisciplinary research process would require first initial assessment of the various stakeholders, and we propose a analysis using desktop review. And here we can look at some of the stakeholders. Could be just not doctors, but could be employers, insurance, trade unions, community members, and family members. Approximately 20 subjects can be chosen for this. And then patients who are directly involved, hopefully they are purposefully selected from the various industries, and another 20 subjects can be used as preliminary study. A small snowball approach to recruit other participants can be used, and the recruitment will be purely a purposeful sampling. In the next phase would be to look at the inclusion criteria, and this is the listed here. And once we have the sample size, the 6 phases involved in the TDR approach. Here are the 6 phases that have documented. From the exploratory phase is to kind of understand, and these are the expected outcomes that you can see. And the consultation phase is when we try to analyze and synthesize knowledge to develop a understanding of the problem. And then they are prioritized, and from the prioritization phase, we try to integrate the list of concerns and complex problems among the members to then generate a program where a joint agenda of solution, which will be discussed and agreed upon, to then to be implemented as a pilot project in the community. So the stakeholders have very important to identify. Here we have listed some of the stakeholders and the level of power that they have in producing outcomes. So it is important to understand this. This is just a preliminary assessment of the stakeholders. This needs to be done in detail by the local researchers so that we can understand who the stakeholders are and the powers that they have in creating solutions. So the description of the various actor groups, there are lots of groups that needs to be engaged in this. From the core scientists, here we have described what the groups are and the definitions and the description of the actors. So the surgeons would be part of the professional practice experts who can then provide the information for the researchers to be able to help in the collection of data and knowledge creation. And we also summarize the roles and stake of the various actor groups in this research. So here's again the details of the various participants, including at the local level, the case actors, which some of the patients and their families will need to be included in the study. So what's next from this? So the important step now is to form a research team in Bangladesh to look at this problem. And the first phase is to study the lived experience of patients suffering from injuries. And from there, we'll be able to then understand the concerns and challenges from which we can then generate the various problems and prioritize them to get the solutions to be implemented. Thank you.